Hello, guys! Welcome back again to my YouTube channel. So this is Paolo Bridge, your Pinoy nurse here in Singapore. So for my today's content, guys, I'm going to share to all of you about what are the struggles of a foreign nursing aide here in Singapore. Okay, I repeat, what are the struggles of a foreign nursing aide here in Singapore? Okay, so before that, don't forget to like, share, and subscribe my channel. Okay, don't forget. Okay. So by the way, guys, for those who are new in my channel, way back 2011, I am a nursing aide. 2011 to 2014. But I forgot already which month I was. I mean, which month is it? But 2000 to 2011 to 2014, I am a nursing aide. And I believe I have the rights to tell my personal experience when I was a nursing aide. Okay? So, I made the list again regarding these struggles that I experienced before. Okay? First in my list, guys. First in my list is the salary. That time is the salary of a nursing aide is really low. I can say it's really low. I mean, but if you compare to your home country, if I will convert it in peso, it's quite big. But if you will compare for those working here in Singapore, it's really low because nursing aide is under work permit holder. So by the way, for those who doesn't know, there's a category. So like example, work permit holder, S-Pass holder, E-Pass holder, something like this. So actually, you can search that in MOM. But for nursing aid, it's under work permit holder. So the bracket of salary is not really big, okay? So I remember if I'll be happy already if I go McDonald's once a week. But the life there, that time, the life is very simple. I enjoy not so much stress. Okay, so that is first in my list. Salary of nursing aid is not much. Second in my list, this is applicable only for those who are nurses, registered nurse in their home country. So second in my list is that time I feel really degraded. I somehow in my back in my mind in my heart I feel degraded because of course I cannot practice my nursing. I cannot practice my nursing profession here. I'm not saying that nursing aid is not a nursing process, not a nursing profession, but I mean, in your home country in Philippines, I'm a registered nurse, but when I start here, I'm a nursing aide. So even I know the procedure that my staff nurse in nursing home doing, I cannot do because I'm just a nursing aide. So even you know how to do it, but you cannot do because there's a limitation. You cannot do it because you're just a nursing aide. So sometimes some are feeling like degraded that some of my friends like they are ICU trained, they have long experience there, even sometimes they are head nurse in their home country, but the luck is not good. When they come here in Singapore, they become nursing aide. Sometimes for them it's really hard to swallow that they need to do this, that they need to do like all the bedside care, but deep back in their mind they know they are very skillful. They are really skillful. Okay, maybe the good example for that is like some like in my current hospital, like some are nursing aid, I mean HCA or nursing aid, but they are really good in canalization, inserting cannula, because in their home country they are staff nurse, they are really well trained there, but they cannot practice much because here they are just HCA, they are just nursing aid. So sometimes they will feel like really degraded. So that is second in my list. Okay, that is only for my personal experience. Okay, so if you don't agree with this, then just comment down below. Okay, third in my list is nursing aid job or HCA job is really physically tiring. How to say physically tiring? Because you will do a lot of bedside care, changing diaper, showering of the patient, turning, everything. A lot of bedside care you will do. So my best tip is take care of your back. Take care of your back. Proper positioning, okay? Take care of your back because you will do a lot of changing diaper. You will, how to say, you will know already if the patient pass motion. I mean, if they are the feces. I mean, if they pass motion means like if they're BO already, like you will know the smell who's that patient who pass motion and everything lah. So it's really tiring because you will take care of a lot of patient and you will do a lot of bedside care. And some your staff nurse cannot help you because your staff nurse doing their staff nurse work. So it's really physically tiring. Okay. Fourth in my list is example if you are just new in Singapore and I think if like your English is not so good before, I mean I'm not saying my English is so good before, like also I cannot speak that much, then there is a language barrier lah. And also it's not only English because they're if you cannot speak Chinese, Malay, of course, sometimes it's quite difficult for them to understand you because some of the patient cannot speak English, right? So there is a language barrier. That is the one of the struggles that I encountered before when I was a nursing aide. Okay. Ay, sorry by the way, guys. I have a list, so I keep on looking on my list because I tend to forget what I right. Okay. Next in my list is okay. Need to work hard to be promoted. I guess I think that is my experience before lah. Because I really we really trying we really did we are doing our best to be promoted because we can be promoted as enrolled nurse as long as you have nursing background in I mean as long as you're licensed in your home country. So we really like need to work hard to be promoted. So sometimes really physically tiring lah, you need to work hard. Like but what they said sometimes you need to work hard and uh work smart. So I don't know what's the term. I mean, what is work smart? But that time I just work hard lah, just do whatever my superior tell me. So it's quite difficult to be promoted that time. So either they will see your performance, your attitude, and everything. So even you're good in your work performance, but you have bad attitude, then it's quite difficult to be promoted as well. Okay. Next is if you don't have nursing background and if you're not a registered nurse in your home country, your promotion is limited. You can only just go to senior nursing aide, senior healthcare assistant. So unless they will promote to you to supervisor. So I think I have some colleague like they don't have nursing background, then I think the highest position they get is assistant supervisor or supervisor. This is in nursing home. But in hospital, if they really don't have they are not a registered nurse in their home country, then they need to either need to study again or need to be registered nurse in their home country so that they can be promoted as enrolled nurse or staff nurse, or else they will just be just like a senior. So there's a limitation in the promotion lah. Okay. Next in my list is limited learning. Okay, how to say about what? Why did I say this? Limited learning means because you're just doing all the bedside care. But I mean, you need to be proactive to learn, need to observe. But that time is like during my time, because of course you're really tired already, so you need to make an extra effort to learn extra skill or not to forget your skill because the whole day you will just do bedside care and that is the learning that you will know only. Other than that, no other nursing skill that you will learn. So that you need to step up to read so that you will still continue learning. Okay? Next is what else? I think that's it. Okay, I think the last is if you are a work permit holder here in Singapore, you cannot apply permanent residency. You can only apply if you're S-Pass holder and above. So I think that is one of the struggle lah. Because I know some of the work permit holder colleague that I know, they've been here in for how many years already, like 10 years, 15 years, but they cannot apply permanent residency in Singapore. And some more, sometimes like the maximum for work permit holder is 15 years as far as I know, but then they need to study like they said like a ITE course. ITE is like a course, it's like they need to go to that school so that they can extend their work permit stay, their work permit visa. So that are the struggles that I know. This is based on my personal experience and some of my friend. Okay, so if you don't agree about this content, just comment down below. Okay, I'm just sharing, guys lah. I'm just telling you the truth. I think it's good to tell this, right? At least you know what will, not saying that what will happen to you, but at least you have idea already for those who have experienced it. Okay, guys? So I think that's it. Thank you for watching my blog and continue watching my blog. Okay? So bye-bye.